Welcome, everyone. Thanks for attending our insurance renewal meeting here via Zoom. You have to bear with me a little bit. I'm used to talking in front of all of you and seeing you all in front of me and having you react to my jokes and whatnot, and I'm not going to have that. So it's going to be a little different, a little awkward, but Tessie promises she'll laugh at the appropriate times for me.
No promises.
So we're kind of excited about our insurance renewal this year, which I know that's something that you're not used to hearing. But we had an interesting year with COVID and the insurance industry and the medical industry in general. I believe as a result of COVID has really seen a decrease in claims. And those decrease in claims have really translated to a very strong renewal for us. So I'm happy to report that with Anthem Blue Cross Blue Shield, they have given us, for the first time in the history of I've been doing insurance at this company, a 0% increase in the premium for our plan. And that's with no plan changes. So that's never happened in my time. And we're happily taking advantage of that 0% increase and making no changes to the health insurance plan to you guys, no changes to your contributions for the health insurance plan. Basically, everything from the health insurance side will stay the same. One thing we want to do is we want to really take this opportunity to refresh everyone's memory on how the HSA and the HRA. So if you remember, the HSA is the health savings account, of which, and Ralph's going to put this up on the screen for us here. So we have two sides. Is that on there? It is. No, but I don't know that it's.
Not yet.
You see it? Can't see it? No.
Okay.
Yep.
But we just had it, didn't we?
Hold on one second.
No, you're good.
Go back to Zoom.
We had. Well, we just had it on there.
Yeah, bear with us one second, gang. Connect to more apps, maybe.
No, we definitely don't want to do that.
Go down here to Zoom.
We won't go out of that window. That's my problem. Okay, hold on. I got a better solution.
Click one more time. Share screen.
There we go.
It's up now?
It's starting to work.
Okay, can everybody see that?
Yep. There we go. Single
Okay,
family.
okay. So if you remember correctly, as with last year, if you're a single or you're a family, we have two programs. We have the HSA, which in the case of a single covers the first 2,500 of your claims. Okay, so 1,250 of that you put into your HSA out of payroll deduction. 1,250 of that Collins and Jewell puts into your HSA out of payroll additions, I guess we would say, or adding it to your HSA account. Deposits would be the word. And then after that $2,500 is met, there's a HRA which kicks in. HRA stands for Health Reimbursement Account. That deductible is reimbursed by Collins and Jewell to you through Diversified Group Brokerage. So Patrick's going to get into the details of that, but that's something we really want to refresh everyone with and have everybody remember the process under which to make sure you submit for your HRA deductible reimbursement. So again, in the single plan, that's how that looks. On the family plan, it's basically the same, just everything's double. So it's 2,500 of the HSA deductible is coming out of your payroll deduction. We're adding 2,500 into your HSA account on behalf of Collins and Jewell for a total of $5,000. And then the HRA deductible after that HSA is fulfilled will be another $5,000 that you'll get reimbursed through C&J or by C&J through DGB. So with that, I'll let Patrick kind of take over. Charlie is, you all recognize Charlie. Charlie's with us remotely here today. Charlie, before I pass it to Patrick, anything you want to say?
like to say, how unique the renewal is. I mean, Patrick, in our block of business, we probably have about 150 employers. Have you seen a 0% increase on any of your other? I haven't.
Never.
So,
And Collins and Jewel had a lot to do with that. In the negotiations, they were not taking no for an answer. So out of the gate, this was actually started off at a double-digit increase, went down as low as 8. And then again, Chris stepped up to the plate and demanded a 0, or they were moving it, and Anthem came back with, okay, we will give you a flat increase. So have I seen it before? Never.
Right.
So thank you, Chris.
Yeah, it's all good. Hey, you don't know until you ask, right? That's the name of the game.
It was more of a demand. You don't know until you demand. There was no asking in that. But again, Pat Kieran with Diversified Group, to Chris's earlier point, in Ralph, can you put this up right now if you don't mind? Do you have that, the open enrollment?
Open enrollment?
So Ralph's gonna put this up. At the end of the day, you understand that Collins and Jewel is gonna give you $1,250 into your HSA account annually, okay? You are responsible for $1,250 towards your $2,500 deductible, okay? Chris just explained that for you. What your provider's office sees, what Anthem Blue Cross Blue Shield knows, is that you as an individual are responsible for the first $5,000 worth of coverage. All right, as a family, you're responsible for the first $10,000 worth of coverage. In reality, you are responsible with your dollars and with the HSA dollars provided by Collins and Jewel for the first $2,500. If you exceed $2,500 worth of claims, you need to notify Diversified Group. Ralph is kind enough to let you come into his office or to contact him first and foremost. But we do not want to, we want to make sure that there's no employee or dependent or plan participant under the Collins and Jewel plan that is coming out of pocket more than $2,500. Again, your provider's office, the hospital, the facilities do not realize this. All right, behind the scenes, they're checking benefits, and according to Anthem Blue Cross Blue Shield, you owe the first $5,000. So through bills, and most importantly, through explanation of benefits that you can get via Anthem, will tell you if you're coming out of pocket collectively more than $2,500 per person. If that is the case, you need to contact Diversified. You can start with Ralph. Let us help you research that so we can make sure that we reimburse you anything over $2,500 and prior to Anthem kicking in 100% of the bill. So if you see, to what Ralph just put up there, let's just start with the open enrollment. It says no plan changes. There are 0 plan changes to the Blue Cross Blue Shield plan. In fact, there's 0 plan changes to the HRA. We just want to stress and make sure that you guys understand the HRA, the reimbursement, the dollars coming back to you to make sure you're not paying more than you should. All right, help us to help you. So you can see this is what Blue Cross Blue Shield knows. This is what your providers know. The single deductible, $5,000. So the provider's office knows that your responsibility before Blue Cross paying is the first $5,000. As a family, collectively, you're responsible for the first 10. So a husband's responsible for the first 5, wife is responsible for the first 2, prior to Anthem Blue Cross Blue Shield kicking in. If you can scroll up a little bit, there's the health reimbursement. So the health reimbursement are dollars paid directly to you, the employee or the plan participant. If you show us proof, which is an explanation of benefits from Blue Cross Blue Shield, that says collectively your claims have exceeded $2,500, we're going to pay you the next $2,500 of eligible charges directly to you. We're going to cut a check to you for that difference. Again, if there's any questions, any concerns, you're not sure if you hit it or not, reach out to Diversified. You can start with Ralph. He's going to hand out my business card that has my number on it. Feel free to call me at any time. If you have insurance now or you're new to insurance, if you have not done so lately or yet, you need to register with Anthem. All right, anthem.com. Provide that website your ID card, put in your access information plus password, will give you access to your virtual ID card. It'll give you access to the network. It'll give you access, most importantly, to your explanation of benefits. With the explanation of benefits, it proves to us at Diversified that yes, you've come out of pocket north of $2,500, and it's time for us to start reimbursing you. So if you have not registered online and you have the insurance covers, please do. It behooves you to do so. It's anthem.com. It's going to require a login and a password. Once you have that login and password, it gives you the ability, and again, all of this is in this packet right here, but it gives you the ability to now download their mobile app. Their mobile app is Sydney.com.
This is the booklet that I passed out to everyone. I think everybody here that's on right now got this yesterday. This is the booklet that Pat is referring to.
And if you can see me, it's on page 19. This is the mobile app. All right, there's nothing easier in today's world than the mobile app. We all have smartphones. First and foremost, you have to go to anthem.com and register into their online portal. All right, it's going to ask for your ID information, which is your ID card, and then it's going to ask for a username and a password. Once you have the username and password, you can break out your phone. You can go to the App Store or Google App or Google Play and just type in under apps, Sydney. It's going to pop up immediately. And it's going to ask for the same username and password. And once you put that in, you'll have access in real time to your ID card. So you no longer have to carry it around in your wallet. You can present your phone directly to the provider's office or the hospital facility. It gives you access to the network. It gives you access to all the additional benefits that come with Blue Cross Blue Shield. And most importantly, it gives you access to your explanation of benefits, which we need to make sure that you satisfy $2,500 in order for us to pay you. Again, we want to make sure that yourself, your spouses, and your dependents aren't paying more than they have to. All right, to Chris's earlier point, you're responsible for the first $2,500. Out of that first $2,500, half of that on an annual basis is going to be paid by Collins and Jewell directly to you into a health savings account. That's your money. All right, so in reality, if you get sick and end up spending 15 days in the hospital, what should be coming out of your pocket at the end of the day is $1,250. The bill is going to be north of $5,000. $1,250 is going to be coming out of your pocket. $1,250 is going to be coming out of your HSA, which Collins and Jewell contributed that $1,250. And then you are going to get reimbursed the next $2,500 via check to pay the remainder of that bill.
So Patrick, as an example, say I have shoulder surgery and my bill is $6,000. I'm single. So I got to pay the first, explain how that works with my $6,000.
So here's your $6,000. So we know the bill is $6,000. You're responsible for the first $5,000. That's what your Blue Cross Blue Shield plan states.
So first,
Okay.
you'll need to show up.
Correct. You're going to get an explanation of benefits from Blue Cross Blue Shield. If it doesn't come in the mail in a timely manner, you can go on to anthem.com and log in, or you can utilize Sydney and do it right from your phone. That explanation of benefits is going to tell you that the bill charges were $6,000, okay, of which you owe $5,000. That's the plan. In reality, you're responsible for the first $2,500. So you're going to use your money, be it your own HSA, for the first $1,250. Collins and Jewell contributes on an annual basis $1,250. And then you're going to present the EOB to Diversified Group. You can do it through Ralph. You can call me directly. I'm going to get a copy of your explanation of benefits showing that you're responsible for $5,000. I'm taking the $5,000, subtracting the $2,500, that is not your responsibility, and cutting a check back to you for $2,500.
So I have to get reimbursed from Collins and Jewell for the HRA portion. I have to come out of pocket for that. I have to go to Ralph or Diversified to get reimbursed that money.
That is correct.
Okay.
That is correct.
Is one thing I'm curious though,
Yep.
is I don't know that do you have to go out of pocket first? Can you
No.
get reimbursed prior to going out of pocket?
Yes.
Okay, I believe that's the case too. right?
So you don't necessarily have to pay the bill until you get reimbursed, but at the end of the day, Diversified is not paying the facility directly. We're paying you so you can pay the bill.
So it's not like you've got to come up with $2,500 out of your pocket to get reimbursed for. You submit for the reimbursement of the $2,500. Diversified cuts you a check, then you can pay the provider.
Correct.
I think that's a key point there, guys, that everyone's got to pay attention to, because you don't want to come out of pocket. So you got to make sure you do that coordination. And I think the key part is the EOB, right, Patrick? You got to get that. And I will say this, I've looked at EOBs from Anthem, Blue Cross. They can be a little confusing. So that's why you will see Ralph, or you want to call Diversified so that we can help you. The more questions, the better.
Right.
Insurance can be confusing, so we're going to make this simple.
At the end of the day, if you don't think you should be paying it, don't pay it until you reach out to Diversified Group, or at the very least Ralph.
Yep.
Diversified will be here on a quarterly basis going forward. So 4 times a year, we will be in the office, all right, sitting in a room, asking if anyone has questions, if they think they're closer to their deductible, or they think they need some sort of reimbursement. We are there to verify that, and at the very least, help you verify that. So we will be in the office on a quarterly basis. You will see, dates that we are coming in and available. Please sign up if you have any questions, any concerns. And this is not only to the employees, this is to the spouses and the dependents, right?
Mhm.
9 times out of 10, I do this for a living. I have 2 kids. My wife takes care of the insurance, right? She just does. So if your spouse, husband or wife, has any questions, feel free to give them our contact info.
So just to finish your example, Charlie, so the last 1,000 of the $6,000 will be paid by the provider directly from Anthem. So
There you go.
at that point going forward, any future claims that you have will be paid by Anthem.
And the reason for that, Chris, is you hit your deductible. You satisfied your out of pocket, then it's covered by the insurance company.
Correct.
So again, there is 0 changes in regards to the medical plan with Anthem and the health reimbursement that you have in place. Our concern is that people are utilizing the health reimbursement. We do not want you paying out of pocket when you do not have to.
Mhm.
All right, again, there's no changes. We just want to make sure that A, you're educated, and B, if you have questions or concerns, don't sit on it.
Right.
If you don't think you owe the money, then reach out, at the very least, start with Ralph,
Right.
or call my cell phone or direct line directly. We'll verify it for you.
It's definitely understood, everybody, that these bills can get confusing, as Charlie stated earlier. So don't get frustrated and just sit on it and put it off to the side, because it's still going to be there 6 months if you don't do something about it. So reach out to me, let me know what that concern is. We can start the ball rolling, and we can make this an easier process for you guys.
And I would say one of the reasons, another additional reason behind Chris's negotiation strength and power in making us get a 0% increase, it was this plan design, right? With the plan design, it allowed us to get that 0% increase. So please remember that.
Any questions? If anybody has any questions, feel free to unmute yourself and ask. And again, we don't need to have questions right now at this moment. If you want to think about this and get involved in next week's Zoom meeting too, that's fine. We welcome you to do that. But again, the biggest thing to understand is that, this is the same as normal from last year. It's just, we want to really make sure everybody understands the process. Because I don't know that we went into it as detailed last year as we wanted to this year. And quite frankly, how this came up is I had HRA issues with my claims. So when I was going through all that, I'm like, oh my gosh, I wonder if other people are having the same problem. So that's where we really just want to make sure that everybody understands and communicates with us so that, you're getting the full value of your benefits. So any questions? All right, then we will move on to the next phase of the discussion. So some of you may know this already, some of you may not. But the state of Connecticut, as of January 1st, they passed a law prior to January 1st, but as of January 1st, They started taking money out of everyone's paychecks for a product called the Paid Family Medical Leave. So it's called the CTPM, PMFLA.
Leave
Right.
Act. Yep.
Yeah, so it's a CTPMFLA. That's it. So it's this Connecticut Paid Medical Family Leave. That's what it stands for.
Yep.
So what that means, for those of you who don't know, is that 0.5%, so 0.5% of all of your earnings over the course of the year are going to go to the state of Connecticut to fund a program that doesn't start until January 1st of 2022. So in January 1st of 2022, you'll have the opportunity to be part of this paid family medical leave program. However, you have to pay for it for an entire year before you can do that. So what we've done a lot of research on is how can we help our employees navigate this a little easier? And there's an option that the state of Connecticut gives to businesses where they are allowed to apply for an exemption from this program if they buy private insurance that covers the same exact product as the state product. So we've done a lot of research on it, and we have found a private product out there through the company called The Principal, where basically for the same 0.5% of your wages will cover you for paid family medical leave in the event that you need it. Now, here's the benefit of going exempt and going away from the state program. If you are exempt, you don't have to spend the first year super funding the next year's product. So basically, you will no longer have to have 0.5% of your compensation from March 1st to December 31st come out of your paycheck. You'll get that money going back into your pocket. Then come January 1st, 2022, when our private plan kicks in, that's the only time you'll see that 0.5% come out of your paycheck. So it essentially allows you to not have to be part of the overall state program and still get the benefit at the end of the day. So there's a couple of things we have to do to accomplish this mission. So one thing we had to do is The Principal isn't just going to insure a brand new product like that with without understanding the risk and understanding what the long-term exposure is. So what they required us to do was to include a couple of other ancillary lines of the insurance that we have with the paid family medical leave. So those ancillary lines are the dental program and also the group life program. So now our group life will be through Principal and our dental will be through Principal. The good news is there's no change in the coverage for the dental. The benefit package is exactly the same. The only thing that will change is you'll have, instead of the Cigna network, you'll now be part of the Principal network, which is just as strong as the Cigna network. And basically you'll get a new dental card. Mm-hmm. So the other benefit that we're able to negotiate into this was we were able to get a 2-year commitment from Principal on the dental. So the good news is it's not like next year they can raise our rates to offset the Connecticut paid family medical leave. They're committed to us for these rates for 2 years so that we won't have to do another switch next year. So that's one thing that you'll expect to see coming out in the mail will be your new dental cards. Again, all your providers will handle it no differently than they do now. All the services will be the same. It actually has a couple of little enhanced services. One is the carryover component, I believe, for dental, right, where you're able to carry over a certain percentage of the dollars that you didn't utilize. So if you didn't max out your dental for the current year, there's a percentage that you can carry over to the next year in the event you need it. So that's one of the benefits of it. The whole life, the group life rather, that's all the same coverages, $35,000 for an employee, $10,000 for a spouse, and $2,000 for a child. No cost to you for that. That's included in the package. But one thing that we also will be offering, if you're interested, is they offer a voluntary life package where you're able to get up to $150,000 of insurance on your own life without any sort of tests or physicals. It's basically automatically guaranteed that you can get up to $150,000 of coverage. Now you have to pay for it, and the way you pay for it is in an age-weighted model. So if you're 25, it's gonna be a lot cheaper. If you're 55, it's gonna be a lot more. If you go from the 29-year-old bracket to the 30-year-old bracket, you'll see a small increase from one year to the next. But again, it's a really good way to get additional insurance if you want to, and maybe you have underlying medical conditions that hurt you from getting insurance through the traditional physical and traditional individual policy methodology. So there's one caveat to this whole exemption for the paid family medical leave. And that caveat is we need to have all of our employees vote on whether or not they're interested in us becoming an exempt plan and having an exempt plan. So Ralph is about to bring this up. So essentially, 2 weeks from now, on February 24th, 6th, February 26th, is when we would like to do the vote. What I want everybody to understand is that we need to have everyone vote yes or no either way. If you choose not to vote, that's considered a no. So it's super important that you realize abstaining is really not an option. And this applies to every employee, whether you're in the insurance or not. Because again, this is part of the paid family medical leave, which is across the board for the entire company. So if you're on your spouse's insurance, it doesn't matter. You still need to participate in this and be part of the voting process.
And
So-
we are gonna ask not to vote until the 26th.
Right.
So I sent this email that you're looking at on the screen right now. This went out today. And on Thursday next week, the 25th, we'll send a reminder for everybody to vote on the 26th. But we do not need you to send a response prior to the 26th.
So just so everybody understands the reason on that, the guidelines from the state is we have to give you 2 weeks notice before we do the vote. So that's why, they're not really clear as to whether or not we can get those votes early or not. So we're just gonna be safe and say we'll wait the full 2 weeks and then we'll do the vote on the 26th. So again, I can't stress enough the importance of voting, because an abstention is a no, and that could blow up this plan for everybody. So again, you gotta realize this is putting money back in your pocket. I mean, for some employees, this will be $300 a year going back in their pocket. For other employees, it'll be $150 a year going back in their pocket. But the bottom line is it's real money that you're giving away to fund a program that you may or may not take advantage of in the future. So by us going through the private sector, now we're able to control that. And quite frankly, I'm of the belief that the private sector will probably manage this better than the state will. So again, I'll be happy to answer questions on this as time goes on, as you read through the documentation. I will tell you, there is no,
There's no different in benefit. The
no, the benefits are
exact
exactly
same.
the same. It mirrors the state program. It literally is the exact same program as the state. By law, we have to do that. In order for us to be exempt, we have to provide the same exact coverage. But again, there's no deep dark secret here. There's no big, it literally is just an opportunity for us. Collins and Jewell doesn't save any money as a result of this. So it's not like it's a financial benefit to us. Whether that 0.5% comes out of your paycheck or not, it doesn't impact the company. We're just trying to save all the employees a couple of bucks. And then also have a program that we think will be more efficiently administered. And essentially, I think that's the real thing at the end of the day.
And to what Chris was saying, remember, you're paying right now, you're paying for a service or a benefit that you cannot use until 2022. So if your vote is to choose to go with the private plan, you do not have to pay anything until 2022 when that benefit is available to you.
Right.
So kind of like you buy a car today and the salesman says, you start paying your payments, but you can't drive the car till next year, but keep paying the payments now. Of course, you're not going to do that, right? So you kind of think that one through just as you're going through the voting process and you're going through all that documentation, reading through the documentation I sent, if you choose to go with the private plan, you don't have to pay any benefit until 2022 when the benefit is available.
And again, the vote does not have to be unanimous. It has to be 51%, but 51% of the entire company, not 51% of those who vote. So that's the important thing that has to be remembered with this is, again, lack of action is essentially a denial. And that may not be your intent, but we want to encourage everyone to please participate. And again, if you have any questions with this, I know enough about it where I can certainly answer any of them. We can go through the plan document as far as the principal goes and what they offer and how you can see how it mirrors the state program. Again, it's just an opportunity for us to, I think outside of the box. And quite frankly, the reason this deal is happening too is because principal did agree to give us a 2-year rate lock on the dental. Had they not done that, I would not have been comfortable making this decision because they could up our dental rates next year and we stuck with them because we have the paid family medical leave. So that component of it was kind of a critical piece to make this as an option for us. So the fact that we've got that 2-year rate lock on the dental is great. I think that's all I have for that. Did I miss anything on my list?
Covered everything. Checked it
Life,
out.
the dental, paid family medical leave. Oh, short-term disability is no change. So again, that's still going to continue the path it has through Diversified. It'll still be fully self-funded by Collins and Jewel. The contributions aren't going to change. So there's zero change with short-term disability. I mean, from a benefit perspective, I will tell you that this renewal is zero change across the board. So from start to finish, it's literally zero change. When things would change would be come January 1st of 2022 when the paid family medical leave would kick in. But other than that, there's zero change from the prior year.
With that said, the ID card for Anthem Blue Cross Blue Shield is going to be valid. The one that you have in your wallet or purse right now is valid through next year. All right, to Chris's point, there are no changes. He did just state the dental card that you have is going to be obsolete come 3/1. Principal is going to be sending you via the mail a new ID card. But your Anthem ID card, the one that you have right now, is valid through next year. You will not be getting another one in the mail unless you or a dependent lost theirs. And if you lost your ID card, you don't have it, you can't find it, you need to notify Ralph. So we can collectively reach out to Anthem to get you a new ID card. But new ID cards will not be coming from Anthem. The one you have is valid.
Great. Any questions? Again, feel free to ask now. Feel free to reach out after if you want to, but the floor is open for any questions. Again, we're recording this session, so if you want to get a copy of the recording to kind of revisit some of the stuff we talked about, I don't know how muffled we are and how good you guys can hear us with these masks on, but again, if you want an opportunity to watch this again, we certainly can give that to you.
Any questions?
Wow, we must have killed it. Either we killed it or we put them all to sleep. One or the other. I don't know which.
They're all muted.
That's right.
Asleep.
So, on that vote, Chris, is that casual, verbal? How do we conduct that? Because I haven't read the whole paper yet.
Yeah, so you're going to reply to that email on January 26th or on February 26th.
Yeah.
And you'll just reply with your yay or nay or yes or no.
Okay, and you'll count them up that way?
Right.
So
Very good.
when you reply on that date, Tom, it'll be date stamped and time stamped. So that's why we want to do it electronically. So we have that time when that.
Right. And the other thing to remember and be careful of is don't hit reply to all unless you know who your vote is. So just reply to Ralph only because he's going to be the one tabulating this data. So just be cautious about replying to all unless you want everybody to know what your vote is.
Very good.
Any others? All right.
What about the ones that we purchased, the Colonial Life Insurance or the Colonial Life?
Aflac, yep.
Is that going to impact in some way?
Nope, those all are the same, no change on those whatsoever. Yeah, no difference with Colonial, no different with Aflac, whichever one you have. Again, the only thing you could additionally add, which we could have in the past, but what we want to have everybody understand with the principle that you have the option of that voluntary life coverage. And again, that's something where as an individual, we could give you those rates. We could tell you what you're looking at, but based on your age bracket, that's going to vary from person to person. But again, they don't care if you're a smoker. They don't care if you're a diabetic. They don't care if you're whatever. It's guaranteed issue up to $150,000. And that 150 is on top of the 35 that the company's already covering. So basically, if something, God forbid, were to happen to anyone, you get $185,000 to give to your significant, your family, or your favorite charity, or your favorite boss, or whoever you want to give it to.
Oh my God.
So. Anything else, gang? All right, well, we thank you for your time. You guys were the beta test. You did great. I'm glad we answered everyone's questions. And if anybody has anything else, you know where to reach us.